Everyone can be worried about when they're about to go see a hip surgeon or a knee surgeon or an orthopedic surgeon in general. They might have the fear of have to have an operation. And understandably, anyone who's going to see a surgeon is worried about having the need for having an operation. I can say that it's important to understand that the majority of cases we actually don't operate on patients. I see quite a few patients that I manage according to their symptoms without having to do an operation. It's important to recognize when you need an operation and when you don't need an operation. And in about 70 to 80% of patients, things can be managed without operation. Sometimes you might end up having an operation in the end, but we try and avoid it if we can. The important thing for me is it is a journey, and to establish a good connection with the patient to make sure that they're happy not only with the outcome but also with the day-to-day management of their symptoms. And also it's very important to communicate with the patient with regards to possible options and be clear on all the options that are available. Every patient has a right to know all the options that are out there, and I try and provide that information throughout my consultations. I send leaflets, I send lots of information also upon patient request by email, making sure that they understand what they are going to expect. Whether that is related to surgery or not, it doesn't matter. The important issue is to provide all the information and the correct treatment. And I feel confident I'm able to offer the right treatment, the right surgery, and the right approach through a personalized service to the patient. I'm lucky to have trained in big institutions with excellent reputations for surgical training. I trained in Leeds, where I did all my basic surgical training and my higher surgical training as well, becoming an SPR there. And then I did a fellowship subspecializing in hip and knee replacement surgery and revision surgery for a year. This was followed by a very interesting fellowship where I went to Australia specifically to do another fellowship in Sydney at the Prince of Wales Hospital in the eastern suburbs, where I learned about sports injuries and anterior hip replacement, as well as minimally invasive surgery for the hip and knee. And that gave me the confidence to be able to deal with a multitude of approaches, as well as being able to deal with complex primary hips and primary knee surgery, as well as sports injuries to the hip or the knee. That gave me the boost that I think was needed to give me that slight edge in the management of these cases. And I'm happy to manage these patients comfortably and offering a variety of treatment.